Thank you, Daniel, BC Care Providers, for asking me to be here this morning. It is my pleasure to be the CEO of Greater Vancouver Community Services Society. Seems to be there's a correlation between not-for-profits and the length of our titles. So, Daniel, I also want to thank you because you actually, in your presentation on within.
Did you accidentally summon me?
Oh, here we go. There was a comment earlier, right, about what happens when the cell phone goes off?
Yep.
Isabel?
That was me.
That was him. That was him.
Isabel's fault.
Oh, yeah. I'm going to blame Isabel. It's much more fun now. Okay, you got the guy with a cold and he's distracted and he has no focus to begin with. Okay, Daniel, we were talking, number of items in your pipeline video actually that talked about the urban issues and specifically with us in Vancouver. So thank you for that and shortening up the time I have to speak. Just to give you a little bit of background about GVCSS. Our service area is Greater Vancouver and specifically with our home support area at Vancouver proper. We are the largest contractor with the Vancouver Coastal Health for home support. So a little bit different with my two co-presenters here. I'm dealing with from a home support background versus okay, I won't say that word, residential.
Yes.
Care home. Okay, get the terminology correct. I come from my background is with disability services, and so we learned, there's certain words like ours that you didn't say, so I get that. As a service provider, 750 staff, 600 who we employ with home care, so a significant organization. As I indicated, not-for-profit, we are unionized, and we've been providing operations since 1972, so that's a little bit about us. The challenges, I think the number one thing that's been identified here already is, of course, affordability. The CEO, I live in Chilliwack, I commute to Vancouver because my $550,000 home that I own in Chilliwack will cost me $2.8 million in Vancouver. And so how our frontline workers can afford to live unless they were born and raised there, it's a challenge. The rate of pay versus cost of living doesn't, so it's significantly. A lot of our staff commute, and so in rural areas I hear about transportation being an issue. Transportation is an issue in an urban area as well, because especially when we get weather conditions like ice storms, snowfall, and in this country we know how well we don't necessarily adjust. So with our employees are commuting, transporting, public transit isn't always reliable. And so on days like that, like those, it is a challenge. And also, if they can get employment in where they live, in their community, versus having to commute into Vancouver, makes sense. So that's an additional challenge for us there. Shortage of applicants. We've talked about people not coming in, and the amount of immigrant staff that we have. I don't think we're any different than anyone else. A large portion of our employees, English is a second language, country of origin is other than Canada. Substantial, right? The competition with other organizations, not just other organizations, but other industries, as we know. We've heard that this morning, so I don't have to go into that. And just, the pool of applicants not keeping up with the demand. Now, Jeremy's talked about that already. Some of the things that we have around safety issues is within Vancouver. Of course, there's some areas of the city they're not as safe to work in as others. Especially with home care, we have the working alone issue, to where we have to be creative, buddy systems, things like that, in order for our staff to be safe. So not just the slips, trips, and falls during ice times, but also about the safety in communities. A couple of weeks back, one of our employees was actually on the news having been assaulted in outside of walking through a park. So that's some of the things we have to worry about within urban communities. And that wasn't even the inner city. It was another community outside. One of the things specific, maybe this isn't just necessarily an urban, but it's home care versus residential. Yeah, okay. Now you got me thinking.
You're right.
Which one? Which one is it? By being urban, people often assume that transportation, like the density of the population, you don't need that. And here's another, bad words I'm going to say is travel time. Okay, we don't say that. I see people shaking their heads. Yeah, no, we don't say that, right? But there's the assumption that because of the density, you don't need those words. And so what happens is the compounding and the challenge with our staff is back to back to back to back, and the feeling the rush and the satisfaction with their job of being able to, the culture, we talk about the culture, the people, why they get into this industry. Why they get in when they feel a rush and they can't develop that personal relationship is challenging, and it's pressuring them to going, this isn't what I signed up for. And so we're often having that discussion, and it's that challenge of, okay, how do we do that, incorporate so we're not, the staff aren't feeling so rushed with the relationship. Again, that's maybe more of a home care issue, but again, with the urban area, again, the lack of transportation time type of thing actually works against us because of the assumption that we can beam me up from here and put us down here. We do have that wage differential, again, home care, that wage differential between residential and home care being lesser. And also the consistency of shifts. I almost said that wrong, didn't I? Within home care, of course, that's always doesn't, I talk about back to back to back, but that's usually in these blocks of time. Nobody needs service necessarily between 11 a.m. and 3 p.m. Everybody wants their bath in the morning and wants their medication at 3 p.m. and that. And so the challenge with our home support people is that, yeah, we're busy. We don't need you now, and we're busy. So that's an additional challenge, and again, that's compounded by being in an urban center. Isabel, you talked about the full-time, and that for some people, and I recognize the comment back was that, yeah, it's not always about full-time. And yeah, we do see that where we got some people who want to be part-time, because let's face it, a majority of the people that we hire, this is the second income in the house, just out of necessity. So some of them do want full-time, want the benefits because their spouse may not have benefits, or because of commitments in the home, only want part-time. So it's not necessarily simple that way. The other thing that we're facing is, again, this is compounded within the inner city, but not just necessarily there, is the complexity of care that we're seeing. Whether that's mental health, Alzheimer's, but also things like seniors homelessness. It's tough to provide home support when someone's homeless. So it's one of the challenges we see, and we're unfortunately starting to see more and more of. Also the quality, oh boy, that didn't take long for me to get there, did it? Okay, so solutions. I guess for us just looking for that, yeah, one of the things we've done, and I think a lot of providers have done it, is the referral system, and you talked about that, Jeremy, around the word of mouth and being that positive influence, and for people that enjoy their job of being able to tell their friends and all that. So that's something I think is imperative, whether that's urban or rural. The other thing that we're trying to do is get that small town feel, the culture of the organization, why we're here, why we came into business. And even in a large urban situation, still within the organization, providing that small town home feel of, yeah, why you're here is important. So those are a couple of areas. I want to thank you for the time, and I'm going to hand it over to our third speaker.